Whilst you are breastfeeding your baby, you may have lots of questions about the types of foods that you should be eating and how this might impact yourself and your baby. So that's what we are addressing in this video. For breastfeeding women, breastfeeding does take up a few extra calories. So lactation approximately, and it really depends on how much you're breastfeeding, whether you're doing it exclusively and how often your baby is feeding. So it's really difficult to actually kind of definitively pinpoint how many extra calories it uses. But as a kind of ballpark figure, it's estimated that breastfeeding takes up an extra 300 calories per day. And you are likely to find that you get very hungry when you are breastfeeding, and this is perfectly normal. The key thing is, like we said in our previous video, is just to keep eating when you feel hungry. So if your body is telling you you need some energy and you need some more nutrients, then eat when your body feels hungry. The general healthy eating advice applies. So if we go back to the Eat Well guide, those 4 main food groups, your starchy carbohydrate foods, your fruits and vegetables, your dairy foods, and your protein, beans, pulses, meats, fish, eggs, those foods are still really, really important. There's not a huge amount that is different for breastfeeding women in terms of the nutrition that they should be getting. Some of the advice that you may have heard during pregnancy to be avoiding certain types of cheeses and unpasteurized foods or kind of rare steaks or undercooked meats, all of that advice no longer applies during breastfeeding. You'll be pleased to know you can have things like pate and brie and medium rare steaks. Those kind of things now are absolutely fine. And that's really because the type of bacteria that is a risk during pregnancy, the Listeria bacteria, can't pass through the breast milk to the baby. So even if you are having unpasteurized cheeses or mold ripened cheeses and undercooked meats, there's no risk of the baby becoming ill because those things can't pass through to the baby. The only things that you do have to be wary of, and this applies to all women actually of any kind of childbearing age, so if you are likely to go on and have another baby in the future, things like the oily fish. Oily fish is a really good source of omega-3 fatty acids. So it's great for your breast milk, for passing through those omega-3 fatty acids to the baby. And they're really important for brain health, cognitive health, and baby's eye development as well. So it's great to be including foods like that if you eat them. But the key with oily fish is to have it no more than twice a week. And that's really just because some of the pollutants and the levels of mercury in those fish are much higher, and therefore it's not something that's going to pass through the breast milk, but it's more of a concern if you go on to have babies in the future. And the other thing is larger fish like shark, swordfish, marlin, those kind of fish that you were advised to avoid during pregnancy, you can now eat. They are, again, larger fish, they're higher up the food chain, so they do contain more of these levels of pollutants, more mercury. So it's not that it's a concern during breastfeeding, but it is that if you're going on to have a baby in the future, it may be more of a concern there. So you can have those larger fish, but no more than once a week. Some of the things that you do have to be wary of that will pass through the breast milk to the baby is caffeine and alcohol. So if you are having things like tea and coffee, fizzy drinks also contain some caffeine, and also chocolate contains a little bit of caffeine as well. So those types of drinks are just to be mindful of how much of that you're having, and trying to make sure that you have no more than around 200 milligrams of caffeine a day. If you are finding that your baby is becoming particularly unsettled after you've had things like that, then it might just be worth going for the decaf options if you can. So to give you an example, something like a filter coffee, 1 cup of filter coffee has around 140 milligrams of caffeine. Instant coffee has around 100 milligrams of caffeine per mug, and tea has around 70-75. Your fizzy drinks and your chocolate would have slightly less, at around kind of 50 milligrams per can of drink, or for around about 100 grams of chocolate, it would have about 50 milligrams of caffeine. So it's just being mindful of how all of those things add up if you are quite a tea drinker or a coffee drinker, and remembering that that caffeine will pass through to the baby through your breast milk. And the same with alcohol. Alcohol will pass through your breast milk to the baby. So ideally, we should be avoiding or limiting the amount of alcohol that you're having to around 1 or 2 units once or twice a week. And because it takes time for alcohol to leave your system, it takes around about 2 hours for 1 unit of alcohol to disappear from your system. So it's just being mindful of when you have an alcoholic drink and timing it right with your breastfeeds. So ideally, kind of making sure that you don't breastfeed within around 2 hours of having 1 unit of alcohol. The other thing to mention that's important for breastfeeding women is to be taking a vitamin D supplement. So a vitamin D supplement of 10 micrograms a day is recommended for all breastfeeding women, and also for your babies as well. So for breastfed babies, right from birth, it is recommended to be giving them a vitamin D drop, and anywhere between 8.5 micrograms to 10 micrograms a day is recommended. You can get vitamin D drops, they're called Baby D, and there may be other ones that you can get. The best thing to do is to ask your pharmacy and find out which ones are suitable for newborn babies, and make sure that the dosage is correct and give them to that every day. The way that you can, if you're breastfeeding, probably the best way to be giving the vitamin D is to either drop it onto a dummy if they're sucking the dummy, or drop it directly onto your breast before a feed, and then they can take it that way. If you are taking a multivitamin already, you may find that your multivitamin supplement already has vitamin D in it. But if it doesn't, you can buy vitamin D supplements on their own, which have the 10 micrograms a day recommended for breastfeeding women. If you're doing a combination of feeding, or if you're moving on to formula feeding, if your baby is having more than 500 mils, which is around about 16 or 17 ounces of formula milk across 24 hours, you don't need to worry about giving your baby the vitamin D supplement, because the formula already has it added in. It's only when they're taking less than 500 mils of formula milk, or when you're breastfeeding exclusively, that you would need to give that vitamin D supplement to your baby. The reason that vitamin D supplements are recommended is because we don't get a lot of vitamin D through the foods that we eat. There might be a little bit from oily fish, from eggs, from some dairy products, but generally as a population we don't get enough. The best source of vitamin D really is sunlight, but in this country we don't get enough of the right type of sunlight for our bodies to be able to make vitamin D to the extent that our bodies need them. And particularly for newborn babies, we are obviously very careful about exposing them to too much sunlight. And that's why, as a safeguard, it is a government recommendation that pregnant and breastfeeding and newborn babies who are being exclusively breastfed should be having a vitamin D supplement. And it's also recommended for all children from the age of 1 to 5 years as well, as a safeguard. And the reason that vitamin D is important is because it helps with muscular and skeletal health. So vitamin D and calcium go really well together, and the vitamin D will help your body absorb calcium. So it's really important for kind of strong bones and teeth, and particularly for growing children who are developing their